And if our shows are live, most times they're not broadcasted. So we are live.
That's fine.
Hi, everybody. My name is Beatrice. Welcome to AfriSend with BT. We are so honored to have a chat with Dr. Samwiri today. He is very, very busy, as all the guests we've had, but I'm so grateful that you've made that time to come. So I'll let him introduce himself and tell us what makes him wake up in the morning, what who he is, what he's all about, and you guys can put your comments in the little chat below. Dr. Samwit, you're welcome. Thank you for coming to our show.
Well, thank you for having me. I'm honored to be here.
Mm,
Long story short, I'm not a very complex character. Just to, I guess, the beginnings. Um, I was born in Uganda, mostly raised in Uganda, as I like to say, but I've been in America longer than I've been in Uganda now. But
mm,
I came to America in '98. Um, and I have two younger sisters. And basically I'll share as much as I need to as far as that
mhm,
journey and the adjustment. Um, but for a living, I'm a physician. I'm a radiologist, and we can break that down a little bit later. But
mm,
um, what gets me going, I guess, was your question is, I think I am blessed to be in a position where I enjoy what I do to start off.
mm,
I'm able to go in every day and not be my own boss, but for the most part, just do the things I like to do the way I want them done,
mm,
and have the autonomy to, to intervene on people's lives and make a difference, build personal relationships. And also I'm actually blessed to be in a good work environment. So that kind of gets me going every single day. It's, yes, I'm busy, but most days don't feel like work. Um, Part of that is, when you're in this field, work becomes almost a second thought. But I can't say majority of the people love their job like I like my job. So to me, it never really feels like work. Um, so yeah, I'm an open book here to answer any questions and kind of give you as much details as needed,
yeah.
as far as my journey and so on and so forth.
Well, thank you so much. So you said you were born in Uganda, grew up in Ghana. So at 98, how old were you when you transitioned?
So 98. So I was 12.
So you were
Oh,
just
okay, sorry. So I just
joining
finished P7. I
P7. So
went
you are
to
going
I went to
to
Green Hill, right? So I just taken
mm,
my PLE, and that before the results even came out, my parents
you
brought
had
me
to
here in
transition.
December.
So did you go straight to high school, or did you
So
have
that
to
was a tough
do?
thing, right?
Yeah.
So at 12,
Hmm.
they did not want me to go to high school just because high school ages are, I think, between 14
Oh my
at
goodness.
that point. So
Yeah.
there was a discussion of to like where do I test. So
Mm-hmm.
yes, I was supposed to go into high school, but they decided to, well, it was already half the year in December, so they were like, well,
Mm,
just to get your feet wet, do these. I think I did 2 quarters of eighth
mm,
grade,
mm-hmm.
and then I went into high school.
Was that a better transition in the sense that because most
No,
kids in high school are bullies and
no,
no,
no.
it's
It, wa-
funny.
it was very hard,
Mm,
in a lot of ways. One, there's the culture shock, of
the
course,
culture
right?
shock.
Two, even the eighth. So my mindset was, I'm going to second. Well, okay. My plan was not to come to the United States, and they
Yeah.
didn't tell me that until I remember I came around Christmas,
Mhm.
and I was starting to get anxious. PLE results had come back, and I'm like,
Yes.
okay, so
Did I
my goal
pass?
was to go into Budo, and then all of a sudden, my parents start talking around the issue of going back, and that's when I got real curious, looked at my ticket, realized it was a one way,
One way
and I
ticket.
lost it, and
You're
I
like, no,
lost
my
it.
friends are in Uganda. I have to go
Yes,
to
yes.
this college
So
with them.
yes. So again, the mindset was, all my me and my all my boys are going to
We
go
are
to
going to go
Bordeaux.
to
We're going
this
to
college.
X, Y, and Z. So
Yes.
that um, redirection from that mindset to, okay, now they've thrown me in this school with people that I don't know. Like
Yeah.
I'm here for only like two semesters, and then we get another transition into high
To
school.
high
So
school.
it made it a little bit, it made it a little bit rough.
So, would
Um,
you say if parents are trying to transition, because I know some parents are trying to decide that they're already citizens that apply, they're thinking, when do I apply to bring my children? Should I bring them? And I know they can, like in California, at 12 years old, you can stay in the house alone. So they kind of think about that daycare situation where they don't have to have a nanny at home. But then, in terms of the child's mind, should they come like midway high school? Should they come 2 years before the end? Or it doesn't matter? Shock is shock. They will adjust, kids figure it out, and just decide as a parent.
right. So the shock will be there. I think the biggest thing, if I would have done it differently, if I
Mhm.
had the option, I'd have
Yeah.
made it less of a transition. Like, right, I was transitioning into too many things, right? I
Mm,
was now going
yes.
into secondary school, not just secondary school. Now you've put me in eighth grade, which is also a
Yeah.
transition year, at the end of a
Yeah.
transition year for the kids that I'm in school with. And then there's high
Yeah.
school, which I don't even know what to expect, right? So
Yes.
there was just a lot of transitions that were happening. Um, my sister, who was a year below me,
Mm-hmm.
um, kind of the same boat.
Mm-hmm.
I wouldn't say her experience was so much different from mine. I mean, so she came in, and then she did a full, well, 2 semesters of seventh grade, and then did eighth grade. So she had um, a couple more years in one school, but and I can reach out to her and ask her, but like
Mm.
again, I think her experience was the same as mine. It's going to be
Yeah.
rough. Um, I think the one good thing is where we moved to.
Mm-hmm.
So we moved to Cincinnati, and the reason for moving to Cincinnati, there's a decent, close knit Ugandan community there,
Yes. And so that's
and
important.
right, so they had people around our age ish.
Mm,
So it was. I think that was a very key component of, yes, I have people I can kind of relate to, people who have been here
yes,
longer than I have, to kind of help you
yes.
out, so on and so forth. Um,
And whose
and
parents
then
spoke Matoke and Lumonde and that kind of
yeah,
plantain.
so yeah, so again, so it was still culture shock, but
Yeah.
the more commonalities that were forged by having a small community of Ugandans there, actually hands on. I'm not talking about people who are in the area that you hear about, right? So we lived in an apartment below Ugandans.
Nice.
We had Ugandans about, walking distance. So it was an easier transition because you had people that were actually hands on,
Oh,
um,
good.
to
But
help out.
it literally takes a village during that transition.
Basically, basically,
Okay.
basically.
And so in high school, did you I know friends, like I have a friend who actually ended up somewhere midway high school, went to prison, and somehow came, spent a few months there because of a fight, and then came out. But so many Ugandan parents don't realize that this could be their child. Like if you don't guide your child well and allow them to assimilate with well, associate with the right people, how do you go through high school and then decide what you're going to do at college?
So, so interesting in the sense that at 12, so I have my youngest sister's was around 6 at the time.
Oh, she was a
Um,
baby.
my middle sister's a year younger than me,
Oh, yeah. Mhm.
and there's a as far as the mindset of the child and how focused they are.
Mhm.
I think the Ugandan education and kind of background played it was very key.
Yeah.
Education before we got here was really important, right?
Yes.
So when I went to school, regardless of how much there was bullying, so on and so forth,
Mm,
I still had my head on straight,
yes.
right? In the sense that I still valued education, so on and so forth. So
Mm,
if you would ask me, was that the perfect transition time for that? Probably, right? In the sense
mm,
that yes, it wasn't. I was still young enough to make a lot of adjustments.
yes.
But I already had a good foundational
Solid.
background
Yes.
to kind of propel me academically. Right? So
Yes.
academically, but that's different from social.
Yes.
right? So social, it was awkward and difficult, but
Mm.
academically, it was, I think, the
Felt
right time,
ready. Good.
right? So my
Mm.
youngest sister, again, she was 6. So with her, it was, she didn't remember a lot of Ugandan
Uganda. Yeah.
upbringing, right? And she was
Mhm.
6, so it is what it is. But like her mindset was a little bit different,
Different.
and it was harder for her, just because, again, the mindset of when our parents, when they bring us here, they have to work,
They have to
right? So
work.
there was a little bit of a transition time where they had to rely on me and my middle
Your other
sister to kind
sister,
of
yeah, to
cultivate that in
babysit
her.
and yes,
Right. But again, she took a little bit of, it was harder for her to kind of get this academic thing as an important key of, her future, right?
yeah.
And
Do you
she's
think
still okay. She's doing
mm,
great.
mm,
But
it was
it was a
harder?
little bit, it was harder for her,
Yeah, but
right?
it's so funny because our parents, I feel like they always say, this is like my parents had 8 kids, right? And I always feel like that's typical parents in that era. And they raise the first three and they expect the next three to raise the next three and the next three to raise the next three. So they were like, make sure they chastise you, you're very book oriented because the next lot knows that this is how things are done in this house. And it's not a guarantee because you can all grow up in the same home and you all just turn out so different because you experience life differently. So that's one of the questions we have as a couple. Jack and I, we have 2 toddlers right now, and we keep saying, do we stay and raise them in their fundamental years here, or do we move and raise them? It's because we are big on academics and we want our kids to be really students. So do we move them and raise them and then they come back ready for high school, ready for college? Like that's a question in young people's minds when it comes to their children, because we both are nurses, so we kind of have that privilege of we could travel and just raise our kids in Uganda and just come for one travel a year. But is it wise as a parent to make that decision?
I think the support system that they have in place,
Hmm.
in both in Uganda and um, here, is also very important. Um, for example, when we were in Uganda, my mother came here 2 years before,
Mm,
right? So to kind of
mm,
set things up, so we're there with my dad.
mm,
But again, my aunties, two of which stayed at the house we lived in, had the
mm.
same mindset. They were
I
both in
see.
education, right? So
Yes.
basically, they played a key part in, even when my mother was a disciplinarian. My
Yeah.
dad cannot harm a fly, and
No. But
if
of
you
good
if you
cause.
had seen the younger me, you would have so many questions right now. But anyway, to say the least, I had a lot of energy. I had
Yeah.
you know it, I needed a lot of intervention to keep me focused, right? So
Yes.
that support system was there in Uganda. So
Yes.
if there is, and also I went to Green Hill, and
You are like the
my
spoiled children. Green Hill people are like rich people, spoiled children.
no, see,
Kids.
mine. So again, so the reason I went to Green Hill was my grandmother was a principal at Green Hill,
So
right?
no play.
So again,
You have to
the structure
focus.
was there, right?
Yes.
So the structure to make sure that I stayed focused was there,
Yes.
right?
Yes.
So
Mm.
transitioning here, it was kind of the same thing. I wouldn't say they had to be as hands on as far as keeping me
Yes.
focused, but
Mm.
even when my mother was at work, we had people come by the house. Hey, homework
Checking.
done, blah blah blah, X, Y, and
Yes.
Z. So I think the support system to kind of reinforce whatever values that you and your husband have for your children is very, very,
Yeah.
they have to be on the same accord, right? I can't, you,
Yes.
you can't take them to Uganda and expect the Uganda system to magically do
Do its
magic,
thing.
right?
So
You have to
basically,
have,
we have to parent. We have to do the work.
yes, the work has to be there,
The work has
right?
to be done. All right. So I mean, it makes a lot of sense. And so in high school, when do you choose to do medicine? when do you do medicine, and when do you like, at what point do you decide? Like I said, so many young Ugandans, they start out saying I need to do medicine, and then somehow they just stop at biochemists and they work for, different research centers, and they just stop at that. So how do you make that decision, and how did you plan, like in terms of finances and scholarships and all that stuff? Because we have some people who have joined college now, and yes, maybe they haven't applied for a couple of scholarships, but there's still room. But that journey, do you get? We had that going to medical school, you need to be interviewed and things like that.
Right.
Mm.
So we'll start in high school, and I'll share a story as to what my first taste of medicine was like. So basically, I would say in high school I was
Mhm.
not very academically challenged,
Yeah,
and I had figured out the game.
yeah.
And basically, what I would do the first 2 quarters,
You
I
let them
I, I did
fly by.
I whatever. I just knew if I had a C by midterm, I could
Yeah.
make my C an A by the end of the year.
Oh my
Right,
God.
just because there was no point in me struggling the whole
And
working
the
hard the
whole
whole time
academic,
because
yeah.
I knew I could recover. So there
Yeah.
was a teacher of mine. He was in biology,
Hmm.
and he told me. So he'd had me. I think it was my freshman year,
Mm-hmm.
and he this was my sophomore year.
Hmm.
So he noticed a trend of what I was doing because I think I
I
had
see
like
you.
2 classes with him before, right? So
Yes.
again, I performed well in his class, but he noticed like the first 2 quarters you couldn't find me anywhere in the top of the class, and
Yes.
then I got my stuff together at the end of the. So he told me I'm not going to give you an A in this class, um, because I don't think you deserve it. And I was like, dude, if I perform to get
I
an
know.
A, you cannot give
You
me you
cannot
cannot
tell
not
me to
give me
my
an A,
A.
right? So just please give me my A and we were all good.
Keep
So he's like,
going.
well, I will only give you an A if you attend this course. He said, yeah, you're wasting your talents. I want you to attend this course.
I love such
Um,
teachers.
so it was at the University of Cincinnati. Okay, so
Mm.
University of Cincinnati. Now again, this is my sophomore year. So
Mm.
the reason I did the course was because they offered money over summertime, right? So they'll give you $400, but it was a healthcare exposure program.
I like that.
So I went, and basically I shadowed a pediatrician who was
Mm-hmm.
actually Kenyan.
Mm-hmm.
And this story comes full circle because even into going to medical school,
Yes.
I kept contact with
This
the same
particular
program.
person.
But
Wow.
again, this program it started off my sophomore year. Again, I did it just because it was offering me money.
Yes.
So I did it again my sophomore year,
Mm-hmm.
and then there was a junior program, and then they had some smaller programs that were for college kids.
Mm-hmm.
Right, so I
Mm-hmm.
did about 5 of these programs. The good thing
Wow.
about 5 of these programs is they tied you closer and closer. Not only did they expose you to medicine, but they
Wow.
tied you closer to people,
Your
very important people with
your network just kept
basically,
growing.
right?
Nice.
So come time for medical school applications, they know who I am, right?
Oh my God.
There was no. So my sister is also in medicine.
Yeah.
She's an ER doc,
I remember you
and
mentioned that. Yeah.
she also kind of followed the same track, right?
Nice.
So to me, my exposure, I don't want to call it accidental, but it was
No,
kind of
it was that
it,
one teacher who saw you and said,
so I won't give him all the credit just
okay,
because I had an interest in science, right? So
good.
it's something I actually enjoyed,
Mm.
um, and in these programs
Mm-hmm.
that got me exposed to medicine, you're like, oh, medicine is not that bad, right? I was like, oh,
Yes.
you had
Yes.
fun that day, and literally the people that you're going to shadow are just showing you cool things every single day. So you're like, hey,
Yes.
this is fun,
This is fun.
right? So as you go up the ranks, you're like, okay, I'm decent at academics. Um, what 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 paths are in front of me, right? So then
Mm.
you have the good thing about staying on top of academics is it widens your field, right?
Yes.
If you
Yes.
don't, if again, I'm not saying anyone needs to always be a doctor or a lawyer or etc, but either
Mm.
way, just you keep your options open.
Yes.
So within that exposure, these exposure programs, and
Mhm.
I, I I started to appreciate medicine, and I think the decision was to go to medical school
Mhm.
happened. I think my sophomore year of college
Wow.
is when I was like, okay, this is what I'm going to do.
I
This is what
want
I
to
want to do.
do. Yeah. So before you finished high school, you really hadn't made up your mind. You were going
No,
to
in
be
the
in the
sense that
science
yes, I was
world, but
interested, but I was like,
mm,
I could be something else.
mm,
If you would have asked me my sophomore year of college, I would have
mm,
told you I'm going to be a doctor. There's nothing else I'm going
mm.
to do.
Yes.
That's a different paradigm for um oh, I could be a doctor. I could also be this. I could also be that. I could also be
Yes.
that. Right. So
Yes.
there's a saying that goes like, if you want to survive on an island, you burn the boats. Right. In the sense that, like, if I still have an escape route, my my drive to make life on this island is right. So I would say I burnt the
Yes.
boats at around in my sophomore year, where I was like, okay, this is
Okay, this
it.
is it.
I'm
I'm
going
all
full
in.
force. Yeah.
Mm. You know what? Let me ask you: are those the shadowing programs you went to? Do you think they're still up? Do you have a? Do you remember the name so we can add it to the comment for parents who are trying to? Because I know when I was in Boston, and I know I met you through UG Buddy, which sentence I was working on, and I used to mentor young people. But I remember they have a program called YARAP where they do sort of something like that. They kind of help high schoolers go, and it's a paid program, and you can choose to go the either college route or you can go the career route. So they kind of shadow and work, and so if you don't mind, whenever you remember, just so we put it down here. But those things are important, I'll tell you, because I think one of the reasons why I remember I went to Gayaza High School, but we used to have the old girls come back, some with their husbands, some with their boyfriends, some with just friends who are professionals. Oh, I'm an engineer. I used to stay in Hamandapolo. And that made you kind of say, okay, that's where I'm going. That's where I'm going. That is invaluable because most times I feel like we keep our kids, especially Ugandan community, all they know is us. And there's this whole America out there. And so the more they interact with other people, the more that whole America opens up. So if you do remember, please let us
No,
know so
no,
we
I do
can put it
remember the
down.
programs.
Mm.
Unfortunately, some of them, I mean, they were under a
That's
grant or
close.
for
Yeah.
for some sort of foundation.
Yeah.
I think the Red Cross was funding some of them, and they're
Mm.
not there anymore.
Mm.
But again, not all hope is lost in the sense that if no programs are available,
Mm-hmm.
it's shadowing opportunities are
Everywhere.
always available in the
Mm-hmm.
sense that yes, you can even go to your pediatrician's office and say, hey, somewhere is interested in medicine.
Yeah.
Can he come here,
Yeah.
let's say, for 1 hour a week?
Yeah.
I don't know, 1 hour every 2 weeks. I don't know,
Mm-hmm.
just to see what you guys do, so on and so forth. Now, again,
Mm-hmm.
with COVID, things might
It's a
be a little
different
bit different,
story. Yeah.
but
Mm.
most doctors' offices will be like, "Oh yeah, sure, we'll take them
Yes.
in," depending on how busy they are. But most
Yes.
offices would say, "Yeah, come by." And again,
Mm-hmm.
the exposure I think is more important than, I mean, just being close to the field and seeing which one. And it doesn't have to always be medicine. It can be multiple
Yes.
different opportunities, just to kind of keep
Mm-hmm.
people connected to what the possibilities are.
Yes. Yes. Great. So you go to college, and so you did 4 years. Did you do what? What
Four
was
years
your
of
undergrad?
college.
Because medicine is basically a master's program, isn't it?
So yes,
How does that work? Because just like law, like to become a lawyer is sort of like a master's program. You do like economics, and then you go back and do your law as like a master's program in a way. So medicine, how does it work
so
exactly?
so medicine. So the I'll give you a a typical route. And
Mm-hmm.
again, I didn't take a typical route, kind of, but
Mm.
most people go to 4 years of college.
Mm-hmm.
Okay. After the 4 years of college, there's 4 years of medical school.
Mm-hmm.
Okay. Then, depending on what subspecialty you are trying to train for,
Mm.
you go to a residency.
Mm-hmm.
So, residency trains you to be, if I want to be a pediatrician, this is my um, residency program. Most residency programs range between 3 years and seven,
Mm-hmm.
depending on what you pick. Then
Mm-hmm.
after residency, there is a fellowship program. So
Mm-hmm.
fellowship program means like you're subspecializing within your subspecialty.
Mm.
Meaning, if I became a pediatrician and I want to become a pediatric sur- um,
Cardiac cardiologist for pediatrics. So.
right. So the second title that comes after your subspecialty is
Mm.
what usually is your fellowship. For example,
Mm.
I am a radiologist,
Mm-hmm.
meaning I am trained in reading MRIs, CT scans, X-rays, blah blah blah.
Mm-hmm.
Um, but my subspecialty is body imaging, meaning
Mm-hmm.
I specialize in all sorts of imaging techniques from the neck to the knees. And
Mm-hmm.
then I did a fellowship,
Mm-hmm.
which allowed me to also do small procedures within that body range, right? So
Mm-hmm.
for me, it was 4 years of college.
Mm-hmm.
I didn't go right into medical school, but
Mm-hmm.
we can skip that for now. So it was 4 years
Mm-hmm.
of college, and then it's 4 years of medical school.
Mm-hmm.
Then it was 5 years of residency,
Mm-hmm.
and then 1 year of fellowship.
Okay. Okay.
So
And would
so
you what?
total, so 4, 4, 6, 14.
Mm. But I mean, when you think about it, because you're coming straight from high school for 4 years and then you go to college 4 years. Because we in Uganda we do high school 4 years and you do 2 years of A level and then you do 5 years and then a sixth year of internship. So that numbers really add up. And I mean, if you don't pause and keep going, it should be okay. Because I know most people are thinking, oh my God, that's a long time. But there's so much you have to learn that time flies. There's so much you have to learn before you know it, you're done. You're done. And so how would you advise financially? How should people plan? How should parents plan? How should individuals plan financially? Because I know when I was onboarding for my current in my current hospital, we had a nurse, a young person. He was an ICU nurse, so he was onboarding as med surg, and he was onboarding as ICU. And ICU nurses, they have like two patients. So and if you work nights, most times you sedate your patients and you should be fine. But he was doing his pre-med. He had his book reading for his pre-med. So I think in his undergrad he had chosen to do nursing for the 4 years, practiced so he can be able to pay for his medical school, and then he was studying for his pre-med to go into medicine. So how do you? That was his financial plan. How do you? Because for undergrad, basically, if you've taken those classes, anatomy, physiology, you should be okay, correct?
So it gets a little bit tricky.
Mm.
So because the exams that you take,
Mhm.
the the MCAT and your board exam certification examinations require you to take certain courses. Like for
Mhm.
college, you have to take organic chemistry. You have to
Mhm.
take, which is, and I'm giving you courses that are just for medicine, right?
Mhm.
Just in order
Mhm.
for you to take the MCAT, you have to take
Yeah.
organic chemistry,
Mhm.
um, anatomy and physiology, yes, but it doesn't play too much, and it's not specific to that.
Mhm.
There's physics,
Mhm.
which is a big part of the MCAT. So organic chemistry and physics are the ones that are very unique to that you're not going to find in other courses. I think that's it.
So basically, if I do my nursing, my bachelor's in nursing, and make sure that I do my organic chemistry and physics, I should be
Basically,
okay.
yes. Actually, funny thing is, there's a lot of people in medicine whose college degrees have nothing to do with medicine.
With
Like
medicine.
my one of the guys I used to studying with, he was an English major, and basically just again took the classes you're required to take for the MCAT,
Mhm.
and then English,
And
and
English
then smart guy made it.
made it
He's
and went
okay.
into
He's
medicine.
a he's a neurosurgeon now.
Imagine that. So I mean that transition, because I think that's part of the problem. Like when a recession happens, people are so dumbed down that what am I have a college, I have a debt of 100,000 and I'm an English major. What, like, teaching is not going to cut it to pay my debt. Like, it's okay to transition to something that's going to cut it, and just be brave enough to do it. Like, just take the classes and be brave enough to do it. All right.
Right.
So radiology, I know. Tell us more. Like, radiology. Why radiology? Why not pediatrics? Why not cardiology? Why did you choose radiology?
So I think so. This decision comes after maybe your third year in medical school, right?
Mm,
And those are your clinical years. So basically, you're going around rotating in X, Y, and Z,
mm,
right? So just to piggyback off our previous conversation about loans,
mm.
you have to also have a pulse on like how much whatever field you're
You're going to
going
school
for
for.
would set you up to be not just successful in liking what you do, but also successful in paying your bills and your
Your
loans off in a
bills,
reasonable amount of
yeah.
time.
Mm-hmm.
So basically, so let's start with pediatrics because I thought I was
Mm,
gonna. If you would have asked me in college, I would have said yes. I'm gonna be a pediatrician. Do
mm,
I like pediatrics? Yes.
mm,
Um, what turned me away from pediatrics? One, um, again, you have to look at that the bracket of like how much you're gonna be making versus how much you owe, right? And I'll just
yes.
round my numbers off. I'll just
Yes.
say I owe about $350,000 in
Mm,
medical school debt.
didn't. Mm,
That's not counting college debt.
mm,
But anyway, let's just put a round number. Let's say I owe 400,000.
yes.
Um, I looked how much does the average pediatrician make? Let's say 100 and between
20.
150 and 180.
Mm-hmm.
Okay, so if I want to make more, I have to subspecialize.
Yes.
Um, so to me, what I didn't like about pediatrics was the everybody in pediatrics has you have to do your general training first,
Mm-hmm.
right? So those first 3 years of residency, you're a pediatrician.
Mm-hmm.
And what I did not like about it was, yes, sick kids, sick kids
Mm-hmm.
are resilient. They go through a lot, but there is the outpatient side where I was seeing. I think I was in clinic for 3 weeks,
Yeah.
and I saw a running nose for 3 weeks. Every kid had a running nose.
A running nose, regardless of what organism.
No, 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 no. Right. So again, different colors, but
It's
like,
hard. I feel
and
like they have the same symptoms: irritability, loss of appetite. For
right,
every single thing, you
right,
have to
right,
really know to know what you're
right. So
treating.
then you ask yourself the question:
Do
can I
I
do
want
this
to
for
look
the
at a
rest of my
running
life?
nose for the rest of
And I couldn't.
that is a good question. You,
I could
but
not.
yeah,
And
you're investing so much time for you to change route somewhere in the middle of your career, not your academic life, your
right,
career, like you're practicing now.
yes. So I couldn't do that, and it's a big part of what
That's
they
funny.
do. I'm not
Yeah.
saying it's not important. Somebody has to do it.
Somebody has to. I
It
love
just didn't
my
get me going.
pediatrician. She's the best, Dr.
Yes,
Lisa.
it just couldn't be me.
Yeah.
Um, and then we looked at surgery.
Hmm.
Surgery, a lot of it was work life balance. It just didn't fit.
Yes.
Um,
Yes.
and again, there's stereotypical personalities in surgery.
Yeah.
But I think you also have to know yourself,
You have to know
in the
yourself.
sense that the when you put yourself in the shoes of the people you're shadowing, um, what is this a work life balance you want to have?
Mm-hmm.
Because okay, so it was between surgery and it was between OB-GYN.
Mm-hmm.
OB, I liked it. I mean, it just had basically it had the pediatric feel to it. It
Yes.
had your surgical portion of it. It had
Mm-hmm.
the two sorts of patients.
Yes.
Um, but again, a work life balance was going to be difficult, right? And
Mm-hmm.
I
Mm-hmm.
think on my rotation, like every person delivering wants to be delivered by the person that saw them. So you can
Yes.
never predict on when. a child is
Like
gonna
at
come.
11,
So your life is
11:23,
basically
Dr. Omasi was in our labor. What I'm like, do you ever sleep, Dr. Omasi? Right? Yeah, no, no, yeah,
right.
no.
So you're basically on call
Every single
potentially every
day.
every day. Now
Yes,
there are groups where they rotate, which is how it has to be.
yes.
But as soon as I'm going into labor, I'm gonna call my
My
main pediatrician, and there's always that
obstetrician.
gravitational pull of I'm off today, but man, my patient who I've been with for X Y, right? So
Yes, yes.
so again, work life balance was not gonna fit with surgery and
Mm,
um, OB.
yeah.
So then well, what else? So radiology actually came a little bit weird in the sense
Mm,
that yes, imaging. It seems like a lot. Oh, sorry. There's primary care. Primary
yes.
care, I
My
eliminated it
God. Why did you
initially.
not choose primary care? I want to hear this because now I'm in primary care and I'm like, I have a new respect for primary care physicians. It's intense.
Right. So primary care, again, you put yourself in the shoes of the people you're looking at. And I have very many primary care doctors that I shadowed, but I
Mm,
noticed a common theme being we all get into this. We all get into medicine. We're like, you want to help people, right? And then you balance it with your job. This is a job I'm doing. I'm trying to help people,
mm-hmm,
and this is how I can get my job done and also
mm-hmm,
support my family. In
mm-hmm.
order to support my family, now every patient that I want to see, you have to fit into this window,
15 minutes.
right? You have this
15
15
freaking
minutes.
minutes to read that chart, to see the patient, to document on that visit, to respond to the labs. I'm like, how do
Right.
these people
So
expect our physicians to do all that in 15 minutes?
yes, so 15 minutes. Then on top of that 15 minutes, as soon as you go see the patient, inevitably nobody has one problem. No
No,
one has one
even
problem.
if they tell you right that topmost, maybe if she has time, nobody ever has one problem. They remember when they're in front of you. Oh, by the way, and
Exactly.
by the way,
So then the more interactions you have, the more you feel like pressure to yes, if you talk for 2 more minutes with X, Y, and Z, then that ratio is starting to fall off. Somebody's gonna miss out, right? Something has to give somewhere,
yes.
or you can be like one of the primary cares I used to follow used to spend the whole time with the patient, and I was like, how do you do that? She would just go into the room, talk to the patient, okay, walk into the next room, talk to the patient, and you're like, how are you spending all this time? And then she stayed in her office from 5 p.m. to 10:30, documenting everything from every patient. Right? Again, so
And that would probably be me because I'm like, I treasure my patient time. I am a hoarder for that feeling. Like my, but then it cheats you. It cheats
so then
your children. It cheats. Oh my God, no,
so the work-life balance is
it's not there. Yeah, I
right.
have respect for PCPs. It's intense.
Yeah, so there was it wasn't for me. So again,
But I
radiology
love the way you are thinking because you're not just falling in. You're
right.
really thinking about it thoroughly because I think because most of our like immigrant families we just think of like money, 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 money. You're not
So
thinking that
again, I'm a big advocate of money is important.
money is
I would
important, but there has to be that balance because you don't want to be so exhausted or you
right.
wake up 20 years and your kids are grown and gone.
So to me, again, that's me growing up in the sense that to me, I could work all day, right? But when you start to think of, yes, at some point I'm gonna have a wife and kids,
Yes,
and what can give, right?
yes,
So that I think as important as money is, so to me, money is important because you have bills to pay and
yes.
you owe a lot of money,
You owe a lot
right?
of
So
money.
so radiology kind of it snuck up on me initially when I first went into med. I was like, radiology is for like weird people who like to stay in the dark, um, and they don't like to see patients. Um, however, what I realized shortly is it's a very diverse field, right?
Mhm.
I like patients, but I realized that I would like to be in control of how much patient interaction I have.
I like that.
Meaning, if seeing patients all day
Mm-hmm.
um, was great for me,
Mm-hmm.
but with primary care, the issue that I had was as soon as something needs to be done, if it's surgery, if it's, yeah, imaging, if it's, you have to
Mm-hmm.
send them elsewhere,
Yes.
right? So
Yes.
I almost felt like, and this is gonna sound bad, and I don't mean it to
Mm.
sound bad, but
Mm.
like you almost feel like you're a pharmacist in the sense that you see a patient, they tell you about their blood pressure problems, you titrate medicines, and as soon as something needs to be done, you send them, you ship them to somebody else,
Radiologist.
right?
Yes.
So I never felt like, again, there was a part of me that wanted to do surgery. So in the sense that I want to intervene in whatever needs to be done to make you feel better. I don't
Yeah.
want to figure out what's going on with you that's bad and then
And then
send you to
send it to
somebody else to make you
someone, and
feel better.
hopefully that person will do their job, and
Right.
because that's
So
half the trouble.
right.
Yeah, I
So
hear you.
it came
I
down
hear you.
to, hey, with radiology, um, not only do I diagnose the problem,
I can do
I
something
can
about it.
advise the surgeon on what to do.
Mm.
I can do a little bit of procedures to make the surgeon's life a little bit better.
Yeah.
I get to see patients as I, not it's not 100% of my job. It's about
Mm.
20% of my job where you get to
Yes.
see patients and discuss diagnoses, interventions,
Mm.
so on and so forth.
Mm-hmm.
Um, Pay scale, it's up there, so it kind
Mm.
of checked that box off.
Yeah.
And yeah, it allowed me to have the work life balance in the sense that I leave. So my sister's an ER doc
Mm-hmm. Oh my
and a
God, that's
radiologist. So ER
intense.
docs, it sounds like it's hectic, but it's I don't want to call it clockwork, but it's shift work basically, right? So
So
as
you
soon as
don't
my
have,
shift is over,
I
that's
hand
it,
over. Mm.
right? You don't have that in surgery. OB, you don't have that.
Yes, which is good because you kind
So
of want to do your best and leave it there. Like I've
right,
done my best and I've left it on that floor and I'm home and that's it.
basically,
Nice,
basically. So
nice.
radiology, after my shift is done at 5, I've read my last study.
Mm-hmm. I'm
I'm I'm
home.
I'm gone.
Yeah.
I don't. You don't have to call me for anything, so on and so forth.
Yes.
Right.
Yes.
So those are the things that I liked about it. Right. So
Mm.
it gives you the opportunity for for the
Yeah,
life
work
balance.
balance. Mm-hmm.
It's still, you should be able to make enough to support your family,
Support
also
your
pay
family.
bills.
Yeah.
It gave me a decent balance in the type of interactions I want to have with patients.
With
I get
patients.
to see the
I never thought
patient, I
about
get to
that, but
diagnose
that's
the patient, I
important.
get to treat the patient, I get to see the
Mm-hmm.
patient after treatment.
Yes.
So it gave me the full spectrum.
Nice. Nice.
And sometimes, again, it's not bad to, so the flexibility of also some days, if I'm just
Mm-hmm.
reading, let's say today's just a day where I just read scans, I
Yes.
do it. They assign me my cases for the day,
Mm-hmm.
and I do it at, let's say, I don't know, if my son has something to do in the morning that
Mm,
messes with my day. I could say, well, I'll go to your whatever you need to do, and
yes.
I'll get back to the cases, and I'll finish them as before the end of the day.
Before the end of the day. And
Right. So
that's
there's
important.
that flexibility as well.
Yes. Yes.
So it just gave me enough of, it checked off more boxes. Now every single profession you choose is you're gonna have to give something up.
Yes. Yes, and you know what? No, I'm glad because you're giving a lot of perspective that even when personally a med surg nurse, but working on the floor and now working in outpatient and doing like right now I just do case management. That balance, I never thought about it, and I guess now that I'm a parent, I'm thinking more about it. So I guess people should think about it. If you just joined us or you're watching this, this is live, but I know most people do watch it after. Please hit the subscribe button. You're watching AfriSend with BT. We are with Dr. Samwiri Mukasa. He is a radiologist. He's a musawo naye akola bya bifaananyi. Parents, if you're out there, please feel free to leave comments because we know that our young people need guidance. Young people, if you're thinking about transitioning, if you feel overwhelmed and you're like, okay, how do I do this? Please leave a comment below. Dr. Samwidi will be more than happy to answer your questions, to guide you, to mentor, because it's the conversations, it's the people who mentor us that lead us to that place. So, Dr. Samwidi, right now, how is what would you say about parenting? Are you a parent?
Yes.
Are you married? Yes. Okay.
Yes.
So, how would you say, like, what do you advise young people? Do they get married before medical school? Do they marry during medical school? Do they just wait? Like, when does that happen? Because most of my friends wait. I know some of my friends have like do their PhD and they're like, okay, now I have to marry, and then they just find some girl who makes them happy, and then they realize halfway that, oh my goodness, this was not the right choice. So at what point do we make this choice to commit to another person and to build a life with another person? Because 8 years, 10 years for some physicians is a very, very long time, and this is like your 20s. Literally, you've given away your 20s. And where, at what point do we make this decision, or do we not even think about it and just focus on our academics? And then some of us are females, like women, we have a biological clock. We were talking about, I keep sharing about my struggle as a woman to be a mom, and part of it is because I waited. Like, I was so intentional. I love kids, but I was like, this whole child rearing bearing thing. And so some people, some of our friends choose not to have children or choose not to be in relationships, and that's a choice they've made, and we respect that. But for those who are thinking, okay, at some point this is something I want to do, what would you say? At what point do they think about these things and integrate these things?
So, so this is a hard question, just because
Mm,
it's changed over my journey,
yeah.
in the sense that, yes, I had my child after I was done with fellowship. So
Mm,
my child was born when I finished everything.
mm,
Was it planned that way? Indirectly.
indirectly, yeah.
In the sense, okay, so I have known my wife now for 15 years.
Oh, wow.
So we've been together, but the hardest part of our relationship, which caused a lot of back and forth, um, was I I ov- when I was in medical school. Again,
Mm.
remember I told you you burn the boats. That's the kind of
Yes, where you're
that's
like, this is
that
where
was
I'm
the kind of
going.
mentality I was having, right? So,
Mm,
and I remember, there was boards. I don't think, no, it was an examination that I was studying for, and it was a final examination, one of
yeah.
the big final examinations,
Mm-hmm.
and I I think I forgot Valentine's Day. I forgot, um, what comes after Valentine's. Anyway, I had forgotten a bunch of like
The
important things,
important days. I'm like, dude,
dates,
they
just
are on the
didn't.
national calendar. How do you forget these days?
So again, so conversation, and again on Valentine's Day, the other thing is she was in Hawaii, so Hawaii
Mm.
was 8 hours difference.
Oh my
Um,
God.
so basically, I remember calling her up. Hey, how are you? I had a rough day. I was studying for boards, so I mean studying for my examination, and I didn't think nothing of it. Um, Before you know it, like she just like burst out into tears, and I'm like, what is wrong with you? Like, right? But I tell you that story just to tell you like the mindset that I had in the beginning, and it
Yeah.
was, to be frank with you, I think that was what was necessary. It sounds very bad. I'm married to the woman; she's the love of my life,
Mm.
so on and so forth. But, um,
Yes. Yes.
that focus is the reason, I learned of what sort of personality I have, right?
Mm.
In the sense that, yes, when I was determined to make this happen, because in my mindset I'm thinking this is a type of life I want to have for me, my family, so on and so forth.
Yes. Yes.
In the meantime, I have to perform this sort of way. I have to be at the top of the class in X, Y, and Z, so on and so
Yes.
forth. So this is the focus that I need to have at this moment for
Mm.
the future. However,
Yes.
it's not very easy to sell everybody on that dream, right? So
Mm.
if you have somebody else who's, hey, I'm here, I'm not just here just to wait for you until you get done. That's not my job here,
Yeah.
right? So
That won't happen.
yes.
Mm.
So fast forward, now that I have a child and I have
Mm.
a couple of um, co-residents and co-fellow people who I finished my career with,
Yes.
who had kids along the way,
Mm.
and I tell them all the time that now. So my son is 2 years old now.
Mm-hmm.
There's, I don't think I would have been as high of a performer as I was if I
If you were
had a
a
child,
dad.
right? So the the ability, again, the ability of whoever is with you to support your vision,
Mm.
it's very very hard initially,
Mm.
um, because it's hard for them to be, and again, depending on where you are,
Yes.
sometimes people are in medical school and the wife is who or spouse, let's say, is the
Mm.
one that is providing, because in residency,
You're not
in fellowship,
making
you're not making
money.
that much
Yeah,
money,
so they are
right?
kind of
So
paying the bills and taking care of
right,
everything.
and then
Yeah.
on top of that, I don't get all your time,
I know.
right?
It's like
So again,
it's
it
a
depends
big
on what sort of,
sacrifice.
right. So
Mm.
I it depends on what sort of person you are, in
Mm.
the sense that you have to have a pulse on you and your spouse.
Yes.
Um, I can't imagine having a child in residency and fellowship or
Yeah.
even medical school, just because I'm
Yeah.
not that, like, it would be hard for me to focus.
Divide. Yes. Inevitably. Inevitably. Yeah. So,
So
but then you chose to still, you chose to get into a relationship with somebody younger who got you, who understood your dreams, and then
no,
that
that was the hard part,
that
right?
was
So you expect that from them, right? Like, you
yes.
know my test is coming up. You know my test is coming up. So what? What is Valentine's Day? So, uh,
No, no, but I feel, and I do understand her, because even like my husband, I'll tell him, I'm like, these are the few days on the, it's just a guy thing, even without medicine. Like there are some days set on the national calendar, and even then they don't remember. They don't do anything.
right, but again,
And you just love them. You get mad, and then you're like, ah, and then you just love them just the way they are.
right, but then you understand, like, the sacrifice of the other part. It's not
Yes, the other
like you.
person.
I don't want to say you think of yourself as a victim, not
Yes.
because you're like, I've stayed up all night for the last 4 days. I'm trying to get
Mhm.
this done. And you're so focused on me. But
Mhm.
there's another person on that side of the thing who is missed calls,
Sacrificing.
missed
Yes.
Valentine's Day, missed,
Yes.
X, Y, and Z. So it's a sacrifice that I think before you decide to burn those boats, you have to make sure that your what you're what you're going after doesn't jeopardize um, something greater, in the sense
Mm.
that, like, sometimes, like, me personally, I would
Yeah.
focus in so much,
Yeah.
that it would give me blinders to
Everything.
everything that I'm trying to create.
Everything.
Yes, my
Yeah.
goal is to have a happy family, happy wife, happy X, Y, and
Mm.
Z that I can provide
Mm.
for. But in
Mm.
the process of getting there, my goal was, how do I get A plus on this examination, right? And
Yes.
sometimes that causes a rift.
Mm.
And I think the the journey of medicine, again, I don't remember my 20s. I'll be very frank with you. I
Because
don't,
all you do is study.
right. I do not.
Mm.
Um, but I I tell everyone who approaches me about doing medicine in their later lives, is it's quite the sacrifice. You Something
Okay.
has to give,
Yeah.
right?
Mm.
So in doing so, if you evaluate your life and you say, hey, I could potentially, I don't know. Again, it's very very hard to advise somebody on when
Mm.
kids should be a part of their lives. I think it all depends on how supportive and mature your spouse is.
Yeah.
You have to have a conversation of like what is expected of you. I think also your
Mm,
spouse has to be able to communicate with you when
mm,
um, they feel whatever voids, they're going to feel some voids. You
yes.
just cannot be there for them.
Yes.
I struggle to say with kids because I don't know how you reason with a kid. Like my
I
2 year old now, I don't
know,
know
I
how I reason
know
with him. That
how. Yes,
I have an
I
exam
can't be
coming,
here because I no. So
right?
it's a very big.
So to
It's a
me,
very big one. Yeah.
so it's to me it would have been very very difficult.
Mm.
However, there's a good friend of mine who had 3 kids
Oh my God,
through their
along the
whole
way.
thing. I've had friends who are both in medicine and they both
Mm.
had 2 kids. But again, with them, they had a support system
Yeah.
around, right? So the
Mm.
grandmother pretty much came over and was the
Mm.
care
Helping
provider
raise the baby.
of the kids.
Mm.
So either way, something has to give. You have to be
Mm.
in a comfortable space of expectations and
Mm.
um,
And
understanding.
communicating
Um,
and understanding those
right.
like those expectations,
Yes. So
especially
you
from a
hold,
culture where we don't talk, where people don't talk,
and
like
that was
just
my problem. That is my problem.
a culture
Well,
where people don't talk. Like I always say I'm a hybrid because for me, I'm like, no, let's bring it to the table. People fear conflict. People are never direct. I'm like, no, it's crazy, and it's a
no, no,
culture
no,
thing. Yeah,
no. My wife is very direct, like,
that's
right, which is good,
which is
right?
good because it
Because
irons things out. Yes.
right, because I
Mm,
think that kind of keeps you not in it keeps you honest in the sense that
yeah.
if I instead of like I would write my whole every day I had like a calendar of how this is to study, right? But after we
Mm,
had that big fiasco about Valentine's Day,
yes.
guess what was going into my calendar? The times was
Oh,
when okay, at this
I have
time
to
no matter
call her.
what,
I
I'm
have
going
to
to
call
call.
her.
I'm going to do X, Y, and
You
Z, right?
invested in
Right.
that.
So in
Yes.
nurturing that
You
relationship, right?
nurtured.
Because it
Yes.
wouldn't have lasted.
Yes. And
So
making that decision. Well, Dr. Samiri, thank you so, so much. Maybe so right now you live in Cincinnati,
no, I'm in Maryland now.
Maryland. You live in Maryland. We actually, my husband has a bunch of relatives in Maryland, and I will be coming to Maryland. So I'll make sure I look for you guys and have some lunch. Thank you so, so much. I honor your time because I'm hoping that I have more young people on this channel focused on academics because it makes a difference. It levels the ground and it sets us up and changes generations. That's just the way I believe things. Because I always feel like no matter what you do, it's easy to reroute if you have that foundation. Like I did my undergrad and I have that foundation, and then I can reroute. And for people to know, like you have the spirit of that immigrant in you, because that resilience of no matter where you come from. I'll refer to Africa and Uganda because I'm Ugandan. So to remind yourself that you have your ancestors in you, that DNA runs in you. You can reroute. Don't get stuck. If things, don't make a transition. It's okay to transition. It's okay to assimilate. It's okay to just keep moving forward. You're watching Africent with BT. Hit that subscribe button, follow. If you have any questions for Dr. Samwiri, please put them in the post below. He is more than happy to answer those questions. And any last words before we leave, Dr. Samwiri?
I guess last words. I'll just give advice for every generation of myself, right? So
Yeah.
if I was to talk to the 11-year-old me, as
Mm,
far as like how to pursue this thing,
mm,
um, um as a child, I had a good foundation of people telling me how important education is, so that was never a problem. However,
mm.
I wouldn't. They would call me naughty, right? So
Yeah.
basically, I was a class clown. I was
That's,
all that, right? So,
yeah.
for a parent dealing with a difficult child,
Hmm.
let's say, I
Yeah.
think it was always important that my parents never gave up on me, and it was
Yeah.
always they never put limits on what I can do.
Yes.
They always tried to find ways to challenge me. I think I had a tutor for as young as I can remember, and that was always to like to keep me focused on things like this. But
Yeah.
the important thing was you can always do anything you want to do,
Yeah.
and that I think that narrative, whether you believe it as a parent,
Mm.
is always important for your child to hear.
Yes.
Um, the well, I guess the teenage me, I think you talked about assimilation, but it's really, really hard
Mm.
to achieve things when you don't have an identity. And the reason I bring that up is, to me, being Ugandan and being
Yes.
different was not cool for when I was in high school. But like
Yes.
as I grew older, like you kind of grow into yourself in the sense that
Yes.
it becomes a big part of your identity, and it becomes something
Mm-hmm.
that you become proud of. And
Yes.
again, for the parent who is raising a child who is struggling with both, I think
Mm-hmm.
having them identify as much as you can, just keep exposing them to culturally what you believe is,
Yes.
where they belong, and they'll kind of
Yes.
grow into that. And I think that will strengthen their ability to not be swayed a lot by peer pressure, because I think high
Yes.
school was a really hard time for me just because
Mm.
initially they told me, I mean, I wasn't cool because of the culture shock. And
Mm.
it was really hard to grasp at, what, like, well, who am I, right? So
Mm-hmm.
as my parents, like, again, we speak, my mother, for example,
Uganda.
we had Luganda in my household,
Yes.
right? So kind
I
of
I
little things
want
like that.
I need to do that.
So little
Yes.
things like that, again, for the child, is that, well, it's not the coolest thing to do, but as they get
Mm-hmm.
older and they are able
What
to
they can do
identify,
too.
I go to Uganda every year. I try to,
Nice.
and I plan on doing that for my child as well, just to keep them as exposed as
Nice.
they can,
Yes.
just because that's a big part of,
Who they are.
becoming me, right? and
Yes.
and I say all that to say, I think when you're identifying where you want to be, whether it's medicine or not, I think the key thing is to identify what is important to you. I was able to eliminate all those fields just because I was able to put it through a filter of what makes me happy, what do I want to have for me and my family.
Yes.
So
I'm coming.
in
Mm.
whatever you pursue, just kind of understanding who you are,
Mm-hmm.
what your limitations are, what you're good at, and kind of amplifying that and making it a plan for yourself will make it
Mm-hmm.
successful, just because you're doing this for the right reasons.
Yes. Yes.
Okay, that's it.
That's it. No, concluded really well. And I'm a Christian, so I always tell people, whatever your religion, your higher power is, like, make sure that you kind of hounding on that, like culture and your spirituality, they go hand in hand, because sometimes some things are beyond you, and just that grounding is the most important thing. And you're right, I moved here when I was 26, so I was already an adult, and I feel like just the fact that I was so sure of who I was and whose I am and where I'm from, it just it's made me much better in every sense. So thank you so much. I really appreciate your time. Thank you, everybody. We're going to end our broadcast. Don't forget to subscribe, Africent with BT, and share these videos. God bless. Bye bye.